enjoy using the SFMA tool as a way to get through my evaluations or my assessments. And one aspect of that tool, an area that we look at, particularly in those people with back pain, is what's called segmental trunk flexion. Most times when people are limited with this movement pattern, we think, or people think that it's because of tight hamstrings, but that's actually only the case in about 20% of our patient population. More times than not, it's actually core weakness that isn't allowing somebody to bend forward at the waist to touch their toes. I am actually one of the 20% where my inability to touch my toes is because of hamstring tightness. So what I want to kind of show you today is first the movement pattern that we're looking at and a quick way to basically get the hamstrings to loosen up a little bit, where you can sort of do a test, treat, and retest to see if in fact that is the limitation or that is the problem, and give you guys a little bit of a look into how we kind of brainstorm and clinically decide what's going on with patients during an evaluation. So first is the test. Again, segmental trunk flexion. You stand tall with your feet together, and the goal is to shift weight back on your heels a little bit, keep the knees straight, and try to get down towards the floor. That would be ideal. All right, so again, I can't quite get there. I'm a little bit tight in the hamstrings. So here's a good trick or exercise that you can do to help promote that motion. Separate your feet a little bit. Okay, you're gonna bend at the knees, reach down, grab your toes. Okay, and from here, forcefully try to straighten the knees up and down. You're gonna do that about 10 times. I'll do a few less just for the purpose of the video. Okay, so again, 10 times would be ideal. You're gonna do it again with your feet out. Okay, same thing, bend, grab those toes, gonna come up and down. Ideally, 10 times, I'll do a few. Okay, come back up. And then the last one you're gonna do with the toes pointed in. Same thing, bend down, grab those toes. Forcefully extend the knees. Now shift your hips up towards the ceiling. Again, ideally 10 times. Okay. And then reset. And now you want to retest. Feet together, tall. Shift your weight back on your heels. Down you go. So again, it's a nice, quick way to get the hamstrings to loosen up a little bit. It'll give us the information we need to basically determine if hamstring tightness is your problem or not. And then we can, kind of look further down the chain. If you have any questions on this or something you'd like to try, go right ahead. Obviously stop if you have pain, and let us know if you have any questions.